Afternoon, all of you. I, Vinod Kumar Gurjar, welcome you all for the webinar on the something different and effective approaches to treat the chronopharmaceutics. Honorable Dr. M. Patel, sir, Provost, Parel University, respected Dr. Abhay Dharamsi, sir, Dean, Faculty of Pharmacy, and Principal, Parul Institute of Pharmacy, Dr. Vanda Patel, Dean, Doctoral Studies and Research, Dr. G.S. Chakrabarti, sir, Principal, Parul Institute of Pharmacy and Research, Dr. Lalit Lata Jha, Madam, Principal, School of Pharmacy. I welcome you all on this webinar. For this webinar, today we have a special guest, Dr. Sunil Jain, sir. He will deliver his talk on something different and effective approaches to treat chronopharmaceutics. Before going to forward, I would like to introduce Dr. Sunil Jain, sir. Sir, it is my immense pleasure to introduce you, sir. Dr. Jain is currently working as a Senior Assistant Professor in Department of Pharmaceutics, Institute of Pharmaceutical Science, Guru Ghasidas, Central University, Bilaspur, Chhattisgarh. Dr. Jain completed his graduation, post-graduation and PhD from Dr. Hari Singh Gaur Vishwavidyalaya Sagar, Madhya Pradesh, and he has teaching experience more than 16 years in university service. He has published more than 60 research and reviews papers in high impact journals, international and national. He authorized 5 books and 4 book chapters, and he delivered more than 10 invited talks at several conferences and workshops in India. The cumulative citation of his publication is more than 2,000 with H-index 20 and I-10 34. Dr. Jain is serving as a reviewer for more than 40 research journals, with few of them as an editorial board member. His research interests include designing nano and multiparticulate technology for the management of type 2 diabetes mellitus, treatment of Helicobacter pylori and colon cancer. He has completed 3 research projects sanctioned by AICT under RPS and UGC. So far, he has supervised 3 PhD students and 18 MPharm students. He is also serving as a member of various committees in the universities. So with this, I invite Dr. Jain, sir. So please deliver his talk. Sir, please.
Okay. Thank you. Thank you, Dr. Vinod Kumar Gurjar, for introducing me in front of this respected fraternity, teaching fraternity. And I thank you for Parel University, management of Parel University, Dr. Lalit Lata Jha, Madam, and other senior faculty members for providing me an opportunity to deliver a lecture on this topic that is very much close to my heart. Okay, and I am working on that technology also. So I wish to share my views in front of you all regarding the chronopharmaceutics. So shall we start? Yeah.
Yes, sir.
Okay, thank you. Yeah. Topic is this something different and effective approach to treat chronopharmaceutics. Our being a pharmacist, it's role of our pharmacist is to use the drug very efficiently. Use of drug whenever it is required to our body. So it is based on that. This technology is based on the use of drug based on the need of the drug in our body. So we can treat the patient very efficiently whenever intensity of the disease is more. Okay, so we can see last 50 to 60 years and more. So much advancement is made in the field of biodegradable polymers, different technologies, different targeted drug delivery systems, and under better understanding of the pharmacokinetics. Actually, pharmaceutics is based on the pharmacokinetics. So better understanding of the pharmacokinetics of the so many drugs. So it was observed that so many drugs provide good effect when they will give at proper time, and when it should be designed in a proper dosage form, then it will be able to treat the patient very efficiently. Okay, so it's uh, just an introduction. Now we can say chronotherapeutics. Chronotherapeutics refers to a treatment method by which drug availability is timed to match rhythms of disease in order to optimize therapeutic outcomes and minimize side effects. And we can define chronopharmaceutics, that is the chronotherapeutics. Now, chronopharmaceutics refers to development of suitable delivery system to serve the above functions. Functions are to optimize the therapy, minimize the side effects, and best use of the drug. Now, before go for in detail, we should know some definitions related to the chronobiology, chronopharmacology, chronopharmacokinetics, and chronotherapy. Okay, so chronobiology, we can say science that studied the biological rhythms. So it's play very important role. Chronopharmacology, study of effects, side effects of drugs upon temporal changes in biological functions or symptoms of a disease, as well as drug effects as a function of biological timing. So it will give an idea when drugs to be given. Chronopharmacokinetics. It deals with the study of temporal changes in ADME to time of administration. It gives an idea when to give the drug, so it will give the better absorption and better disposition of drug. Chronotherapy, coordinating biological rhythms with medical treatment, is called chronotherapy. Now, circadian rhythm. As you know that it's a very important aspect of our life. As you know that if we are habit of taking breakfast in the morning at 8 o'clock, lunch at 2 o'clock, and dinner at 9 o'clock. If you miss that time, and you are not able to take at that time, you will feel very uneasy. Okay, if it's a habit, and you will feel irritated. Okay, so it's based on the our habits developed in our body. Okay, but who it will control? Okay, it's a certain control in our brain also. There is certain control in our brain. So we need to understand the circadian rhythm. Circadian rhythm is the regular recurrence of certain phenomena in cycles of approximately 24 hours. General circadian rhythms in our body, normally body temperature, hormonal secretions, metabolism, sleep are big cycle. Sorry. Okay, see the biological clock. I wish to let you know the biological clock to you all. The biological clock is the mechanism found within living organisms that coordinates the timing of physiological functions and behaviors to the natural day-night cycle. This biological clock, it is located in suprachiasmatic nucleus of the hypothalamus, delivering its messages of the time throughout the body. It is responsible for circadian rhythm and annual or seasonal rhythms. You can see this SCN uses its connections with the autonomic nervous system for spreading its time of day message, either by setting the sensitivity of endocrine glands, thyroid, adrenal, ovary, or by directly controlling in endocrine output of the pineal glands. So many hormones are secreted based on the directions of the this biological clock. I will let you know where is the location of the biological clock. Here. You can see location. You can see this is where you can see the suprachiasmatic nucleus. This is called the biological clock. Okay. This is a long history of the very long history of the circadian rhythm. This gene checks Diotus Myron describes circadian rhythm in plants in 18th century, and Franz Helvor, called the father of American chronobiology, he coined the word circadian. And this is our understanding of biological clocks, starting from the 400 BC. It is started from the ages of Alexander the Great. Endosthenes observed that leaves of certain trees open during the day and close at night. The understanding was on that time. Initial understanding was on that time that leaves uh, of certain trees open during the day and close at night. Now, in 1950, scientists observed that starlings birds use the sun to migrate. Their internal clock reorients them as the sun changes. In 1971, the first clock gene, that is PER, is identified in fruit glaze. 1978, the first clock controlling gene, this is called FRQ, discovered in Neurospora, that is mold, red mold. In 1997, the first clock gene is identified in mammals. Name is mouse clock gene. And 2001, the first human clock gene discovered. A mutation in the HPR2 gene speeds up the circadian clock in people with a rare disorder. So this is about the understanding about the history of the circadian rhythm. Now, this clock genes comes in our discussion. This clock genes. Circadian rhythms are driven by a group of genes called clock genes. In mammals, the core block clock genes consist of BMAL1. It is a brain and muscle aryl hydrocarbon receptor nuclear translocator like one. Second one is the clock. It's the full form of this clock. Circadian locomotor output cycles kaput. Third one is the per period and cry. And they form a tightly regulated system with interlocking feedback and feed-forward loops. Now, this is a 24-hour activity in we can say in mammals, and we can also feel this type of activity in our 24-hour period. Start with the midnight. 2 o'clock, we are in the deepest sleep. Now 4:30, lowest body temperature, it was observed. 4:45, sharpest rise in blood pressure. 7:30, melatonin secretion stops. 8:30, bowel movement likely. 9 o'clock, around highest testosterone secretion is there. And 10 o'clock, highest alertness. We can say alertness is very much there. And at afternoon, 2:30 around 2:30 p.m., we have seen good coordination, best coordination in our hand-eye coordination. We can say our body coordination is very good. And 3:30, fastest reaction time. Greatest cardiovascular efficiency and muscle strength we can see 5 o'clock, 5 p.m. around. And 6:30, highest blood pressure. 7 o'clock, highest body temperature. 9 o'clock, 9 p.m., melatonin secretion starts. Okay, and 10:30, bowel movement suppressed. So we can see the hormones are also secreted at different time intervals, and we have seen activity. So drugs are also react or gives effects according to the activity of our body. Now you can see different differences in the day and night effects of body temperature, cortisol hormones, blood pressure. It is more in the day and low in the night. And this is melatonin, growth hormone, testosterone, prolactin. Reverse is true, we can say. This day, these hormones, level of these hormone secretion is very low, and at night the secretion level is more. Now, this melatonin appears to have two probable interacting effects on the sleep-wake cycle. First is its entrance and shift the circadian rhythm in a chronobiotic function. Second, it promotes sleep onset and continuity in a hypnotic function by increasing the homeostatic drive to sleep. So this is very much important and play very important role in the sleep-wake cycle. Melatonin is an internal sleep facilitator in humans and therefore useful in the treatment of insomnia and the readjustment of circadian rhythm. This cortisol circadian rhythm typically show a rise in cortisol during the night and a peak within the first hour after awakening. Cortisol levels drops quickly during morning hours, increase slightly after the midday meal, both slow, very slow, slightly, and decline slowly through the rest of the day to a low during the night. At night, it's very low. Now, you can see disease. Disease is known to display circadian rhythm. You can see if you study the 24-hour period, we can see the different intensity of the disease when the intensity of the disease is more. Okay, so you can see so many deaths are occurred in the morning. We can see, paralytic attack is there, asthmatic attack is there in that morning. So this is based on the circadian rhythm. Intensity of the disease is highest at particular time. So objective was to develop the delivery system according to the circadian rhythm, so that treatment will be efficient or very good. Now we should see the its duration. 12 noon to this. यहाँ से देखें, यहाँ से start करते हैं this activity. 12 to 18. Hemorrhagic and perforated ulcer crisis, sickle cell anemia crisis. Here you can see osteoarthritis, dermatosis, chronic pain is there, epileptic seizures is there, peptic ulcer disease, exacerbations, congestive heart failure is there, and that's sleep time. You can see apnea and this anginal problems is there, asthma is there, epileptic seizures are there. You can see down to that. You can see migraine, headache, allergic reactions, and rheumatoid arthritis, angina problems are happening in that particular time. So objective of the this to show slides is to have the understanding about the intensity of the disease. Okay, now we can go for applications of chronopharmacology, and after the chronopharmacology, understanding of the chronopharmacology, we can go for chronopharmaceutics. Now, a respiratory system. Increased bronchoconstriction at night due to parasympathetic tone. Adrenaline, parasympathetic tone will be more, reduced adrenaline level and reduced cortisol at midnight, and more sensitivity to irritants and allergens at night. So based on that condition, you see that increased bronchoconstriction at night that cause allergic rhinitis and asthma. More common between this acute attack of asthma, more common between the midnight and 6 a.m. is the common understanding after surgeries. So, what should be the treatment? Theophylline when beta 2 agonist is timed at evening. If you give these type of drugs at evening and planned that they should release the drug at that time, midnight and 12 a.m. Then we can be saved by the asthmatic attack. So here we have the SR formulation of theophylline that should be given daily. That capsule is there. This is increased efficacy, avoid multiple dosing. Nocturnal vagus nerve hyperactivity to relieved by the cholinergic antagonist. Drugs may be ipratropium bromide ले सकते हैं और oxytropium bromide. Okay. A single daily dose of inhaled corticosteroids. If we take single dose of inhaled corticosteroid means we have to take aerosols when administered at 5:30 p.m. rather than 8 a.m. was nearly as effective as 4 doses a day. You see, one dose is effective as 4 doses a day. If you take at particular time, one single dose, if you take inhaled corticosteroids at 5 p.m., it will give better results. Oral prednisone has been shown to be much more effective in improving several features of nocturnal asthma in response to a standard dose of inhaled beta 2 agonist when administered at 3 p.m. rather than 8 a.m. So if you give it 3 p.m., it will give the better results. Now, see the stroke. Many of the patients are suffering from this problem of blood pressure, high blood pressure, right? So blood pressure (BP) rises about 20% immediately after awakening, and it's least during sleep. जैसे आप जागते हैं तो आपको उठना होता है, तो BP will be rise. First 2 hours after rising are the peak hours for hemorrhagic stroke and thrombolytic infarcts. So this period is very much critical. Reasons are increased physical activity, sudden. If you rise very suddenly, okay, this will increase the blood pressure. Increase catecholamine levels, increase platelet aggregation, and increased vascular tone. So that caused these problems, hemorrhagic stroke and thrombotic infarcts. Now you see the pattern. Blood pressure का आप देखें, systolic blood pressure and diastolic blood pressure. You see that this at night dip is there. Dip is there. If you can see, dip is there in the blood pressure. And if you see the rise in the morning, rise at morning hours. Both systolic and diastolic blood pressure are more at morning. Now, treatment. What should be the treatment advisable? Mylon developed a verapamil hydrochloride extended release capsules. Okay, it is formulated as a pill with a cell that dissolves slowly. So it is a sustained release dosage form. Taken at bedtime, this exerts peak effect between 5 a.m. and noon, and no midnight dip in BP seen. If you see, this release system will not release the drug at 2 to 3 p.m. Now it will start releasing the drug, and there is a effect of drug at morning. Riltazem once in the morning, probably in evening. Allergic rhinitis. This is another disease. So many are feeling allergic reactions. Rhinitis. It's worst in the morning and evening. We have observed it. Morning में आप देखोगे it's very worst condition, and evening also. In afternoon period it's very much less. It is a type 1 reaction in which antibodies, that is IgE, are produced which get fixed to the mast cells. On exposure to antigen, AG-AB reaction takes place on mast cell surface, releasing histamine, LTs, PGs, etc., resulting in urticaria, itching, bronchospasm, rhinitis-like conditions, and it is immediate hypersensitivity reaction. So this disease is worst in the morning and the evening. What should be the treatment advice? As per the chronopharmacology, drugs should be prescribed once daily. Non-sedative antihistamine like chloramphenicol to be given before bedtime to control overnight exacerbations and during sleep. Oral corticosteroid therapy for several allergic rhinitis should be prescribed in the morning. Certain cardiovascular diseases and disorders are also there. Myocardial infarction, sudden cardiac death, inguinal pectoris, transient ischemic attacks, stroke. Highest incident between 6 a.m. and 12 noon. Drugs, cardiovascular drugs में हम कुछ ले लें. Aspirin. कुछ drugs का effects देखते हैं. We can see the effects की some drugs then give the good results. Aspirin, maximum antiplatelet effect in the morning. Thrombolytics and heparin, reduced benefit during early morning hours. Atenolol, more effective during daytime. Labetalol, more effective in early morning hours. Enalapril, peak hours, effects in the afternoon after morning dose. Now, endocrine system. It is very much related to the secretion of the various hormones. We can see highest secretion of cortisol occurs early in the morning and lowest at midnight. Growth hormones peaks during sleep. Testosterone peaks early morning. TSH, that is a thyroid stimulating hormone, peaks at midnight. Corticosteroids given at single morning dose cause less pituitary adrenal suppression. So if you give this corticosteroids, you can be get relief in the pituitary adrenal suppression when you give it a morning dose. Gastrointestinal tract diseases are so many diseases are there, and most condition to see that secretion of acid. Unusual secretion of acids, you can see. Okay, so acid secretion peaks between 10 p.m. and 2 a.m. Ulcer pain is worst at this time. Definitely, if the peaks is there, also, you can feel the pain. Ulcer really is directly related to the acid secretion inhibitions at night. So treatment is there. Evening doses of S2 receptor antagonists, such as cimetidine, famotidine, ranitidine, to administer at night. That will cause to prevent you from the ulcer pain. CNS, melatonin secreted at night by pineal glands. Function क्या है? What should be the function? It synchronize sleep-wake cycle with circadian rhythm. melatonin agonist, hypnotic for sleep onset insomnia and reduces jet lag symptoms. And bedtime administration more effective. You see that uh, Rameltion uh, bedtime administration is more effective for the such type of musculoskeletal system, rheumatoid arthritis. You see symptoms more severe at 8 a.m. at morning to 11 a.m. If you see rheumatoid arthritis problems in there, should be very much in the morning. So what should we do? Long-acting NSAIDs should be administered at bedtime. Osteoarthritis, pain more intense between 2 p.m. and 8 p.m. Morning dose for afternoon worsening, evening dose for nighttime worsening. See, morning dose देना है, so you will be get relieved in the afternoon problem, and evening dose देंगे, so you will be not feel pain in the night. Hypercholesterolemia, cholesterol synthesis more at night. It was observed that this cholesterol synthesis was more at night. So evening dose of HMG-CoA reductase inhibitors such as atorvastatin, simvastatin, or vastatin is more effective. So it will cause to reduce the cholesterol synthesis, and this will also very much helpful to the treatment of the obesity. Cancer, widely known disease, so very painful disease to patients. Those are suffering for this deadliest disease, actually, cancer. And we require a proper management of drugs for the treatment of such type of deadliest disease. Okay. So it was observed that DNA synthesis in the normal human bone marrow cells has a peak around noon, while the peak of DNA synthesis in lymphoma cells is near midnight. Means cells का जो synthesis है, that should be at noon, but lymphoma cells, unhealthy cells, is near to the midnight. So in S phase, active cytotoxic therapy at late night should be more advantageous in respect of the data. Skin disorders are also there. Psoriasis, cell proliferation rates peaks between 9 p.m. and 3 a.m. Inflammatory activity highest at night, least in the morning. Atopic dermatitis, sensitivity to histamine highest at night. Topical corticosteroids, activity in the afternoon after higher than in the morning. So the understanding about the intensity of the disease and all this is very much important for the formulation scientist to design a suitable drug release system that will release the drug at desired time, where body needs, where intensity of the disease is more. Okay, so there are so many approaches adopted by the pharmaceutical scientist to design drug release system based on the chronopharmaceutics. So few approaches are there: enterocote systems, pulsatile drug delivery systems, or membrane diffusion control system. osmotic systems pharmaceutical scientists to prevent the drug and bypass the stomach and release the drug component in the intestinal region. There are so many polymers available these are called enteric polymers, which are insoluble at low pH but soluble at high pH. Low pH means they are insoluble in the gastric pH but soluble at more higher pH like alkaline pH. Enteric coatings are prepared from gastric resistance polymers. Drug release is controlled by its exposed pH. Now you can see the schematic of this enteric coating process forms. Enteric coating layer is there, acid resistance is there, core tablet is there, core is there. You can see it is coated by the certain polymers. First layer was the hydroxypropyl cellulose layer, and another one is the acid resistant polymers, enteric-coated polymers. Okay, you can see first the enteric-coated polymers were dissolved, and afterwards this hydrophilic polymer was jellified, and then it will finally release the drug from the matrix type reservoirs or matrix type release system or reservoir type release system. You can see, and then it is drug is available for the site of delivery where it is required. You can see different polymers are there. We can classify into three groups based on the chemical composition. Polymethacrylate, methacrylic acid, ethyl acrylate, cellulose esters, we can say cellulose acetate phthalate, cellulose acetate trimalate, cellulose acetate succinate, hydroxypropyl methicellulose acetate succinate, and hydroxypropyl methicellulose phthalate. And third category is the polyvinyl derivatives like phthalates. Phthalates, we can say polyvinyl acetate phthalates. Polyvinyl acetate is the normal polymer, but if you add the term phthalate, that means it will be enteric-coated polymers. So, things is that we can use the polymers wisely according to the properties of the polymers. So, we can be able to design polymers according to the need of the patient. Now, second one is the pulsatile drug release system. Second approach is that pulsatile. Pulsatile drug release system is defined as the rapid and transient release of certain amount of drug molecules within a short time period, immediately after a predetermined off-release period. That is called lag time. This release system aims to release drug on programmed pattern. Programmed pattern means at appropriate time and at appropriate site of action. Means this pulsatile drug release system will not release for a certain period of time, that is called lag time, and afterwards it will release when it is required. Okay, so it is a chronopharmacotherapy designed according to the circadian rhythm of body. It is a type of intelligent drug release system capable of adjusting drug release rates in response to a physiological need. Types, there are two types: closed loop, open loop control system, and closed loop control systems. First one is the open loop control systems, also known as pulsed or externally regulated systems. This externally controlled devices apply external triggers for pulse delivery of drugs such as magnetism, ultrasound, and electrical effects. Includes the following approaches: magnetically modulated pulsatile systems, ultrasonically modulated pulsatile systems, electrically modulated pulsatile systems, thermosensitive drug release systems. and closed loop control systems. They are also known as self-regulated systems, in which release rate of drug is controlled by feedback information without any external intervention. It includes the following: pH responsive drug release system, glucose responsive insulin delivery, and inflammation induced pulsatile release. See, pulsatile drug release system are applicable to drugs, diseases such as perforated peptic ulcer, pain of osteoarthritis, sensitivity to allergy skin test, stomach acid production, stroke due to hemorrhagic intractable pain, ulcer crisis, asthma attacks, rapid rise in blood pressure, angina attacks, pain of rheumatoid arthritis, nasal symptoms of allergy, migraine headache, stroke due to clot formation, and overall ease of breathing. So it depends on the time, depends on the intensity of the disease. We can see start from the 6 p.m. to midnight to the 6 a.m. morning and to the noon to the 6 p.m. You can see different disease or intensity of the disease are there, and this pulsatile delivery system are applicable and very useful for such type of treatment of the diseases. Now, some commercial products are there. You can see Pulses, Unifile, Ritalin, Beta, Codas, Diffucaps, right? So there are so many active constituents are incorporated in such type of dosage forms, and these are very much helpful for the treatment of so many diseases like pharyngitis, tonsillitis, asthma, okay, attention deficit hyperactive disorder, hypertension, like. And mechanism you can see the mechanism of wide variety applications, very wide applications are there. Now, next approach is osmotically controlled systems. In the osmotically controlled systems, an external fluid containing a low concentration of drug moves across a semipolar membrane to a region inside the device, where the drug is in high concentration. Osmotic pressure tends to decrease the concentration gradient between one side of the membrane and the other. The inward movement of fluid forces the dissolved drug out of the device through a small orifice. And this type of delivery system, osmotically controlled system, you can get the zero order release output. If you want to get the zero order release, this is very much possible with the osmotic drug delivery. This is a schematic of working of osmotic tablet. You can see this is the drug compartment. This is drug compartment. Second one is the drug compartment 2. First drug is there, second drug is there, and this is push compartment. And it is initially first coated with the rate controlling membrane, and there is a orifice. When the water is permeated through the this rate controlling membrane inside the tablet, it will dissolve and increase the osmotic pressure, and it will cause to release the drug from that opening only. You can see the difference when you compare plasma oxybutyrate of concentration. Both type of formulations are there. Immediate release is there versus the control release. Control release के लिए, that is the based on the principle of the osmotic principle. Okay, you can see the pattern. This pattern you will see. This is a uniform pattern. Uniform pattern is there observed. If you see that Pen XL, that is the official the brand name of the oxybutynin, or immediately dosage form is also there, oxybutynin ka, and that should be 5 mg TD. You can see large differences in the concentration. You can see dip is there, now rise in there, then dip is there. So fluctuations is there. So much fluctuations in that immediately oxybutynin. And if you see that the consistency of maintenance of concentration, blood plasma concentration of drug by the this control is dosage form. Now, what should be the characteristics of osmotically controlled devices? Advantages are there. Zero order release is obtainable. Reformulation is not required for different drugs. Release of drug is independent of involvement of the system. Disadvantages are there. System can be very expensive. Quality control is more extensive. It's a little bit difficult to develop such system, optimized system. Examples are, you can see, Accutrim, Concerta, Procardia, Bulmex, or Ditropan. You can see. Now, compression coated tablets. Compression coated tablets are also used. We can use more than one drug. We can use, in this case, we can use different polymers also. Okay. So it is based on the principle of compression. It is a system in which the entire surface of an inner coat is completely surrounded by the coat. These coats prevent drug release from the coat until the polymeric or drug coat is entirely eroded, dissolved, or removed. The technique is very simple. We can get programmable lag phase followed by fast or rate controlled drug release. So, being a pharmaceutical scientist, researcher, we have the ability to program drug release. Okay, so we can get the option with the programmable lag phase in which drug will not release, followed by fast release or slow release or rate control release from the dosage form. Release of the drug depends upon the coating layer and core composition. Okay. It has a solvent-free coating and facilitate manufacturing process. And as I told you earlier, it can be used to deliver one or more drugs. Sorry. Yes. Now, this compression coated tablets, there are few more approaches are there. Multiphasic release, delayed release, time control release, pH control release, and microbial control release. Okay, so we need to use the internal structure, internal physiology of the body also. We can use microbial flora, also pH conditions inside our body also. Now we should discuss one by one. Multiphasic release, and this multiphasic release is a delivery system designed for many diseases which have marked diurnal cycles. In this such diseases, drug concentrations are needed to vary during the day. Drug levels need to be highest when symptoms are most severe. Okay, so in this system, drug is presented in coat. What should be the formulation initially? I wish to let you know that in this system, drug is presented in coat and core as a non-uniform drug distribution matrix, which results in biphasic drug release with the combination of therapeutic drugs in one tablet. A variety of drug release, that is sequential release of different drugs, or multiphasic release of drugs, is achievable by this approach. Compression coated tablets with multiple layers for desirable therapeutic use can be prepared. Different drug release patterns can be obtained with adjusting drug loading and polymer types in each layer. Now, second was the delayed release approach. Okay, so delayed release is obtained when all surface of the core is compression coated. Means in this type of approach, all surface of the core is compression coated. Okay, so you can get the delayed release. Lag time for drug release could be controlled by application of different polymeric coats. Now, time controlled release approach. A delayed release tablet consists of drug core which is compression coated with different polymeric barriers, that is pH independent. Okay, so this delayed drug release is programmed for the treatment of diseases that depends on circadian rhythms. The lag time of drug release is controlled by the compression coating, which prevents drug release from the core until the polymer coat is completely eroded, swollen, or ruptured. You can see when drug will release until the polymer coat is completely eroded, swollen, or ruptured. So we can control the release. pH control release. We can use the interact polymers as I discussed earlier. This can be used especially for delivery to the colon and intestines. Okay. Microbial control release. That is also a very important aspect. A delayed release pattern may be M for colon target. Normally, we can so many microbial flora present in the colonic region also. Okay, you can see alginates are there, enzymes are there. You can see so many enzymes are there. Alginates, amylase, arabino, galactone, arabino, xylon, cellulose, chitosan. These are easily digested in the colonic region. So dosage forms are prepared by to utilize certain microbial flora present in the colonic region. Formulation consideration of compression coated techniques. Compression coating amount is very important. Coating amount क्या है? What should be coating amount? है ना? Position of core in coated tablets, coated layer. कहाँ पर place किया आपने? Where it should be the placement of drug inside the coating layer. Compression force and compressibility of materials. Interaction between drug and compression coat. Now, by the use of certain polymers, by the certain approaches, we will be able to design a delivery system based, that will be give desired results. Okay, so biochemical process, physiological process, behavioral process, we can understand these things. We can combine the chronopharmacology, chronopharmacokinetics, chronopharmacodynamics, and then we can design chronopharmaceutical concept. Starting from all these things, we can go for chronopharmaceutical concept. Then we go for design of chronotropic drug system by functional design, formulation design, process design, and package design. And we can apply so many design approaches. Okay, so this chronopharmaceutical product, what should be the properties? We can see optimal dosing time, time controlled, site controlled. Ideal chronotherapy hogi, the efficacy is more and side effects is very less. More compliance and less difficulty. There are some pics of chrono drug systems like MS-110. diffucaps. Some parenteral routes in chronotherapy include chronomodulating infusion pumps like Melody, Phenomet, Synchromet, Remic, or control is microchips. Oral administration includes Contin, Cronset, Codas, Siphon, diffucaps, Timer, Chronotopic, Egalet, Geoclock, Port, and three-dimensional printing. Now, I should conclude this session. This chrono-drug system is a very promising approach for the treatment of various diseases, you can say. And it helps for better utilization of drug. It helps to reduce the side effects. It helps for efficient treatment of disease, and will certainly improve patient outcome and optimize disease management in the future. So there are lots of scope in the this field, and by the application of chronobiology, nanotechnology, and molecular biology, there are lots of scope. We can develop a very good release systems for the treatment of so many release diseases. These are very recently published books. Queries are invited. Thank you.
Thank you, sir, for sharing your huge knowledge in this area. Definitely, our participant will get benefited and will think about this area also. So now the session is open for question and answer. So participant, you can ask directly, or you can write in chat box also. So please, if you have any question, you can ask.
There is lots of scope. Actually, we can say there is lots of scope in the for the research in this field, and so many researchers may if understand all these things. Okay, that will be first understanding is required in all these things. If you understand the disease, if you understand the drug, if you understand the body, if you understand the disease state, then you will be able to design a very good release system.
Okay. So thank you, sir, for sharing your knowledge about this area, and you spend your valuable time with us. As a token of love, we would like to give you a certificate. So, sir, please stop your sharing screen.
Yeah. Thank you very much, Dr. Vinod.
Yes,
you are my very good student, providing me an opportunity to interact so many good teachers introduce me in front of Parallel University and so many students. So sir, thank you very much. Okay. Yeah.
सर इसको स्टॉप करिए, शेयरिंग स्टॉप करिए सर प्लीज.
स्टॉप?
हाँ, प्लीज स्टॉप शेयरिंग.
ओके ओके. Okay.
Sir, please accept our gratitude in this form of in the form of this certificate. Please accept it.
Okay. Thank you very much. Thank you.
Yes, sir. Thank you, sir.
Okay. Thank you.
Yes, sir. It was a nice session, sir. I have one question, sir. Do we have any marketed formulation for this area? Or
yeah.
It is in this?
As I shown in the slide, there are so many marketed dosage forms are available. for the treatment of such type of diseases. I shown Kodas and form and so many dosage forms are available now.
Yes, sir. Sir, I missed some of the slides, therefore. Yeah.
I will send you. No problem.
Yes, sir. Okay, it is available, then fine. Yes. Thank you,
Thank
sir.
you very much. Thank you, Jamam. Thank you. Nice to. Okay.
Thank you, sir, once again.
Okay, thank you. Thank you.
Bye. Participant, I am sharing you the certificate link. Please fill so that you can get e-certificate.